Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You were 35 or older and you have just found out that you are pregnant. Now what? Pregnancy when the mom-to-be is over the age of 35, what's known as advanced maternal age pregnancy, does come with some higher risks. Here to talk about this is Dr. Erica Berggren. She's an obstetrician and gynecologist with the Scripps Clinic Medical Group. She has a subspecialty in maternal fetal medicine. Thanks so much for being with us, doctor.
Thank you.
So what are the odds of you getting pregnant after the age of 35?
It's a common question we hear, knowing that fertility, so our chances of becoming pregnant, do decrease as we age. After the age of 35, and again, after about the age of 40, there's a significant decrease in a woman's chance to conceive on her own, let's say without any assisted reproduction or infertility help.
So what do you do when a woman comes to you and she is struggling to conceive?
We often receive referrals from our OBGYN colleagues and sometimes our infertility colleagues to help prepare a woman to become pregnant and help her optimize her health. If she comes to us because she's struggling to conceive, we start that conversation, but often do refer them to our partners who are our infertility colleagues and work very closely with them as a woman is seeking various options to achieve pregnancy.
And so what are the risks of getting pregnant at an older age, over the age of 35?
The risks associated with becoming pregnant do depend on age to some degree and also depend on a woman's underlying health. We characterize potential concerns or risks in a fetal or baby perspective and also from the maternal side, the maternal perspective.
But is there a higher risk, let's say, for miscarriage or gestational diabetes, preeclampsia, premature birth?
When a woman is older, some of the maternal risks, like those you mentioned, can include a higher chance of preeclampsia or other hypertensive disorders of pregnancy. Gestational diabetes may also be a greater concern. And what we often don't think about is a woman's underlying health. So as we age, cardiovascular disease, gastrointestinal diagnoses, autoimmune conditions, and diabetes or hypertension before pregnancy, all diagnoses that do increase with age can pose new risks to a pregnancy.
So if a mom has high blood pressure, what are the risks to that unborn child?
With hypertension in particular, a fetus, so a baby, may have more difficulty growing. So a small for gestational age or a fetal growth restriction situation may arise, which warrant further monitoring, further consideration. And those can sometimes lead to a need to deliver a baby earlier than what you would expect to optimize health for both mom and baby.
So if you're 35 or older and you find that yourself pregnant, what should you do to prepare for a healthy pregnancy?
If you learn you're pregnant and you're 35 or older, I think one of the most important things is to see a provider, whether it's a physician, a nurse practitioner, a midwife, early on. What you really want to do is plan and prepare. For many women, they may have planned that pregnancy and already have their provider ready to go. Unplanned pregnancies are also extremely common, and certainly getting in to see someone who's going to be your prenatal care provider early on is key.
And what kind of tests should you be having?
We generally start with an ultrasound. If a woman is referred to our office, the high-risk pregnancy office, we're seeing them for a detailed ultrasound, ideally between about 11 and 14 weeks. Often women think of this as the NT ultrasound because we're measuring a small space in the back of the baby's neck called the nuchal translucency, which in conjunction with other assessments can give us more information about a pregnancy's risk of being affected by Down syndrome or many, many other chromosome or developmental differences for that baby. So that's one of the starting points where a high-risk doctor like myself will play a role.
What about genetic testing?
Genetic testing comes along with that. There are many options these days for women to seek genetic information about her fetus, many of which are non-invasive. So for instance, we can draw maternal blood anytime from about 10 weeks of pregnancy after and assess the risk of that pregnancy being affected by trisomy 21 or Down syndrome and a handful of other genetic diagnoses. Notably, those are screening tests and don't give us all of the information about a baby, but it does give us a starting point for a conversation that may lead to more information if desired or needed.
So what if a problem is suspected or found in these screening tests in either the ultrasound or the genetic testing?
When a concern is identified on a screening test, we see it as a starting point of the conversation because these are screening tests. They don't give us all the answers, and they often generate a lot of questions that we, along with our partners, our genetic counselors, work closely with a woman, a family, a couple to seek answers. The ultrasound plays an important role as well, whether in that early 11 to 14 week time period or later, the ultrasound that people often think of as the anatomy scan. And they know that they're doing that at, well, they'll say 5 months of pregnancy. For us, it's around 19 or 20 weeks, so halfway through.
And if a problem is found, what other steps can be taken?
When we identify a concern on a screening test, or let's say a structural concern about fetal development on our detailed ultrasound imaging, we also have the opportunity to offer women what we call diagnostic testing. One of those options is something many have heard of called an amniocentesis, which can be performed at 16 weeks or later in pregnancy and learn an enormous amount of detail, both about chromosomes, other genetic diagnoses, and much more. The earlier version of that, where we sample the placenta, is another diagnostic procedure called a CVS, or a chorionic villus sampling. Those are two procedures that only a perinatologist or a maternal fetal medicine physician is trained to do.
So do you take care of a woman differently as she gets older for her health and also for the baby's health?
We do. We do a few things differently as a woman ages. Certainly the early ultrasound and the anatomy ultrasound are important for all women. But let's say a woman is 35, 37, 40, but otherwise in very good health with no chronic medical conditions. We tend to recommend an assessment of baby's growth, often around 28 and 34 weeks, but scattered throughout the third trimester to potentially identify lagging growth, new concerns, or even excess growth, such as with the diabetes diagnosis. There's some additional testing we do as well.
And that testing is what?
We call it a non-stress test. Women who have had a baby before might remember when they're in the hospital in labor, the nurses are paying close attention to the baby's heartbeat by putting little monitors on the belly, and also it prints out on essentially a computer screen, and it gives us a good assessment of fetal well-being. I kind of think of it as one step up from simply listening to the baby's heartbeat in your doctor's office. It's a way of getting a bit more information to hopefully tell us that baby's doing just fine inside and has no reason to be delivered early.
So you're 35 or older, you find out that you're pregnant. Are there certain things that you should avoid doing during your pregnancy?
In general, when you learn you're pregnant, avoiding alcohol, avoiding smoking, avoiding any other drug use, and then addressing your other medications, which ones might be beneficial, which ones are essential, and potentially there might be a need to change certain medications in discussion with both your regular doctor and a physician like me, a maternal fetal medicine specialist. Separate from that, we encourage usual activity to the extent that you're able to do. Often women believe that they must decrease their activity and be on bed rest, for instance. And in fact, there are very few situations where that is something a physician would recommend. However, if you're overall healthy, listening to your body is key. I often tell women to keep doing what you normally do, but give yourself a break when you need it.
Talk about the Scripps perinatology program and what is the benefit of seeing a perinatologist?
For us, the Scripps perinatology program offers a comprehensive approach to care across the Scripps system. Women of any age, and certainly those 35 or older, often see us a few times in pregnancy for those detailed ultrasounds, perhaps a detailed counseling session where we outline a plan of care that then their physician, their provider, whether a nurse practitioner or a certified nurse midwife across the Scripps system, can enact. And then we're available for questions, concerns, and to update those recommendations if any new concerns arise. For some women, they see us once and then they're cared for by their obstetricians, their prenatal care providers. Others we see throughout pregnancy and work closely with their physicians or other providers. And for some, we see for their entire prenatal care if their maternal or fetal needs warrant that.
Any final thoughts, doctor?
I appreciate the opportunity to have this conversation. For women entering our office 35 years of age or older, they're often walking in with a lot of misconceptions or fear. And I think the role we often play is to hear them, listen to them, and do a lot of education, because most women 35 or older can and should have a healthy pregnancy. Just because we do some additional testing or additional follow-up does not mean those women should expect anything other than a healthy baby if there's anything we can do to help them achieve that.
Thanks so much, doctor. We really appreciate you taking the time.
Thanks so much. I appreciate it.
If you want more information on this advanced maternal age pregnancy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.